Mic check. 1, 2, 3, 4, 5, 6, 7.
I know, I understand, but I didn't want you to think, I was happy to meet you with the rest of you. That was my request.
You can always meet with me.
Are you speaking?
No.
Good.
I've never
Our part's the
Oh, I did see.
You all right?
Yeah, having a good summer. Got a vacation.
I say come here, but she'd probably hide you.
I'll get together. I'll help you. I'll be.
I know, she's gonna play Sussex.
They're nervous wrecks. Yeah, worried about me.
So
Do my
what's the
best
deal
to
with all the
bust
beds
their
in there
chops.
like that?
That's for the shelter.
But they keep them lined up
That's
like
the
that all the time?
special needs section of the show.
But I didn't know we kept them made and ready.
Oh, that's not for
Well,
this. Probably because of COVID. They just
It is
haven't.
hurricane season too.
This is gonna be the side for the normal
Yeah.
shelter.
Never know.
Those are special needs beds.
Are jam
And they
packed.
have the tilt.
Especially
Back
now.
like that.
This American flag is
Thank you.
drawing blood
Cat
against my
5
skin.
evacuation facility.
You spent a lot of time with Byron up there?
He's a good guy.
Put your fingers in that.
Where's
You get my blood.
Where's Zeke?
Unfortunately, we're not on the floor though.
Where is he?
So, but, yeah, he's really good. Good conversations. Yeah, that's the last thing. He's very good.
Yeah,
It's to be on the thing.
Yeah.
Even though my wife.
He's very
even though
talented.
everybody would probably, you and I got it, nobody else.
Yeah, he's one of my best friends
Hey,
in
it's
the
not
house.
upside down.
So,
Oh, I feel it.
yeah, he had
I'll
to.
see him on Monday.
Yeah.
Go back
Oh, okay, good.
for about 2 or 3 days.
So, the
Yeah, you guys aren't up there very much right now.
What's that?
You guys aren't up there very much right now, huh?
Well, you know, August is supposed to be
I think I told you.
so-called brave. But she's bringing us back. Budget resolution
Well, I
We'll
hope
take
they
our
do.
money, we'll take the state money back.
for a couple of days. That's 3 trillion monthly.
I said, I hope we're the only one that they don't up in the whole country. Because that would be a secret talking about all the
The budget
We still got to pass.
reconciliation, we're done.
No, but that's the only one they did that to. Yeah. But he said they called
bring
him
us
up
back
and
for a
said
couple
they
of
love the
days.
project so much they want to help us get up.
There we go. We're starting, should have started instead. We're starting to spell a little bit too soon.
Well, good afternoon. It's great to be back in Pasco County. Got a great group of folks. We've got Senator Simpson, Hooper, Representatives Maggard and Mariano. I got Kevin Guthrie, the Division of Emergency Management Director, and then Ken Shepke, who's the Chief Medical Officer for the Division of Emergency Management. I know we got some county commissioners, and we have Gus Bilirakis, so I want to thank them for coming. And, we were, particularly since December, we were here in a lot of parts of Wilton's district. I know we did Citrus, we did Hernando, we did Pasco, where we were actually bringing in vaccines to senior communities. We do some of them. I think we did some mobile home communities and some other stuff. So we did, between those 3 counties, a total of 8, where we'd actually have DEM coming in, doing it. We could do thousands of seniors over the course of several days. And so we were here during that, and we were able to get a lot done. Today, we're here, and we're happy to be able to announce that we are going to be establishing a site for monoclonal antibody treatment here in Pasco County, and this is a site that will be open from 9 to 5, 7 days a week, right here at the Fasano Center in Hudson. And this is something that's really, really significant. As we had the vaccines roll out, that was obviously the main center of attraction. At the same time, these monoclonal antibodies were approved by the FDA for emergency use as well, pretty much within weeks of both the Pfizer and the Moderna vaccine being approved. And they have been used by health systems throughout the whole year of 2021. But I think what we had noticed is, as we started to see hospital admissions climb here in this summer, we would talk with hospitals. We actually did a roundtable, and the CEOs were talking about how this was really helpful at keeping people out of the hospital. But then people were contacting us saying, well, I'd never heard of this. And so it's a type of thing where there was not a lot of visibility on it. It had not obviously been promoted to the extent that the vaccines had. And so we said, okay, so let's do some more to let people know it's out there. We did an event at Tampa General. And then we said, we need to just expand the footprint on this. People need to know that it's available. And so we've been establishing these sites throughout the state of Florida. So we have Jacksonville, we have Orlando, we have Brevard County, we just opened one in Volusia County, we have Palm Beach, Broward, Miami-Dade will come online soon, Hillsborough. I'm not going to be there, but Hillsborough is also up and running, and then we are going to have one hopefully very soon in Pinellas County, and then other places on the west coast of Florida we'll be adding as well. And basically, the thing that we've seen throughout this summer is, if you look at the people who are being hospitalized, there's 2 things that are apparent. One, the vast majority of them had not been vaccinated, and so that's the vaccine is kind of the prevention angle. But then also, over 90% of the people who are being admitted did not get a monoclonal antibody treatment after they were infected. And so from both a prevention and a treatment, you see kind of who's making up the bulk of the hospital admissions. It's our belief, based on the data, that if more people knew about this and had done it, that the admissions would have been lower. And we think with more uptake on this, we think the admissions will go lower here in the future. And so the monoclonal antibody is it's a treatment. It's for people who particularly are at severe risk of COVID. It's authorized not just for a treatment for infection, but it's even authorized as a prophylaxis if you've been exposed to people who have COVID. And so this is something that comes up when you're talking about nursing homes. If you have a nursing home resident or staff member who tests positive for COVID, the close contacts, you can then go in and do the Regeneron as a prophylaxis, and it helps ward off a potential infection. And then obviously, if you are infected, could treat it on the back end. So those are the 2 ways to be able to use it. This is a treatment that is free to the patient. It's important to do that because there's people that say that this is costing thousands of dollars out of pocket for people. That is not true. The federal government purchased the whole lot of this as soon as it was developed, and basically have been sending it down. So whatever Florida draws down, we don't pay for, and then whatever patients get, they are not charged for this treatment. And so it's important for people, because you don't want people to be deterred from doing this if it's something that could help them. The key to this, though, is doing it prior to severe illness setting in. Once you're severely ill and hospitalized and in the ICU, the effect of this declines. If you do it early in the infection period while the symptoms are still manageable, this has been shown consistently to reduce the chance of hospitalization by 70%. And these are mostly high-risk people, so that's a pretty significant thing. And I think if you've talked to people who have actually used this, you will find that a lot of them have very good things to say about the experience, how they were feeling, and then 24, 48 hours later, how they ended up feeling after that, and it's usually very positive. So getting it early is important. You can sign up at any of these sites that Florida is doing by going to patientportalfl.com. The health systems are still doing this as well. I mean, Tampa General, they do 50 infusions a day. I know other health systems are doing it, and that's great. And we're trying to supplement what they're doing, not necessarily displace it, but we do believe that because the knowledge of this was so low, as knowledge gains, we do think there's going to be a need to have a bigger footprint, so that's why we're doing it. So the site here will be able to do over 300 treatments a day right here. And obviously, we're assuming, we're going to draw from, of course, Pasco, perhaps depending on where the Pinellas site is, maybe northern Pinellas, and then, of course, we think we'll draw from Hernando and Citrus as well. And that's great because 300-plus treatments a day, that's a lot, and then multiplied all across the state where we're going to end up having, probably by this weekend, what would you say, 10 to 15 will be up for sure? Probably a dozen. Yeah, so probably a dozen that will be up and running, and so you figure 300 plus a day at each of those sites, that's thousands of available slots every single day. And so if you talk about the folks who this could be most beneficial to, you're looking at people who are, high risk for serious COVID complications. And everyone kind of knows the drill on that. You're looking at elderly people, people that have that are immunosuppressed, morbid obese, diabetes, heart conditions, lung conditions, and if you're in that category and you get infected, you have the opportunity to come get an early treatment that's going to improve your chances dramatically. We are seeing folks test positive who have been fully vaccinated. I think you're looking at, I know the CDC and some of them are contemplating these booster shots, and I think the reason why they're doing that is because you're seeing more infections amongst vaccinated people than the clinical trials suggested would likely have happened. Now, I think most of these are mild cases. However, our most heavily vaccinated portions of our population are our most at-risk portions of our population. So if you're somebody who is fully vaccinated, but you do have immune system problems, or you're very elderly, or you have other health issues, even if you're vaccinated, this is still something that could potentially help you. So it's not necessarily tied to vaccination status. It's something that if you're in those categories and can benefit, if you get it early, you're going to be able to do hopefully pretty good. So patientportalfl.com. We think we've already seen some positive results from this. If you look at Jacksonville, we've gotten some good traffic there, and I think the Orlando site will get some data out of that as well as Brevard. And then just yesterday we launched 2 in South Florida, and then today we were in Ormond Beach, and then here in Pasco with Hillsborough also opening. So by Saturday, we should have probably 12. And what do you think we'll end up at? You think we'll end up with 15?
I think statewide, I think we're going to be at 17.
17. So we anticipate pretty soon probably being about 17. And we've had different communities reach out to us, and DEM, they're obviously working to do that. You have some communities where some of the hospitals would do these treatments, but they'd only do it on certain days. And that's obviously, it's good to have access, but you may want to have it 7 days. And so that's where we can maybe come in and plug some holes there as well. So bottom line is, this is something that's readily available for folks. This is not saying that you do this in addition or in lieu of vaccination. It's something you do in addition to, and whatever has been done in terms of your personal vaccine test. Once you are infected, then what do you do? And this is the most effective early treatment that we have, and it has been proven to have great results. And so we want to make sure everyone knows it's available for them, particularly when you have a period where you have high prevalence. And so it's great to be here for this. I will turn it over to some of our distinguished guests here. We'll have Senator Simpson, and then we'll have Director Guthrie, and then Dr. Shepke will deliver some remarks. So Wilton.
Thank you, Governor, and thanks for coming to Pasco County and talking about the monoclonal antibody. And as someone who had COVID in December and participated in with the Eli Lilly monoclonal antibody, it worked very well. Within 24 hours, most of the symptoms are gone. I would encourage everyone to understand the statistics. The governor mentioned them. If you are in the hospital today, there's probably close to a 90% chance you did not get vaccinated. If you are having very serious illness, there's a very good chance you are not vaccinated. If you contract COVID and you have been vaccinated or not, you should immediately seek out this treatment with the monoclonal antibodies. It's very effective. It will save many lives. But what it'll also do is it'll take the pressure off of our current hospital system, which is being maxed, stretched really very thin with our staff in our hospitals. And so opening these sites, Governor, I believe will save many lives. And I appreciate the media being here today to make sure that we get this message out, because the monoclonal antibody needs to be done very early in the process, as the governor mentioned. And with that being done, then I think we have a very good chance of reducing hospitalizations and saving many lives. So thank you for being here today, Governor.
Great. And just to point out, so when the initial monoclonals were approved, you had Regeneron and the Eli Lilly monoclonal got EUA. Both were considered effective against the previous variant, the Alpha. Regeneron, so we're offering the Regeneron because it has been proven to be effective against Delta, whereas the Lilly has not. And then Regeneron is also the only monoclonal that's approved for use as a prophylaxis. So when you're talking about having strike teams going into nursing homes to help nursing home residents, if there's cases in nursing homes, this is very helpful to be able to do that, because if you can do it as a prophylaxis, you're probably gonna provide some pretty good protection at that point. Okay, Director Guthrie.
Thank you, Governor, for your leadership on this important topic. When the governor asked the Florida Division of Emergency Management to start looking at places where we could open up things, one of the things that came out of his mouth is he says, Kevin, I want to make sure we're looking at Pasco Pinellas. And when it came to Pasco, obviously with my background, I knew right where to go. So I want to thank, the commissioners. I want to thank Dan Biles, the county administrator. I want to thank Eric Breichenbach, Andrew Baxter, Mike Napier for helping us get into this facility and getting this set up, because again, we're going to be able to do over 300 treatments here a day, and we're going to be able to save a lot of lives. And that's what this treatment has done, is saved a lot of lives. So again, thank you, Governor, for your leadership, and thank you to local Pasco County Board of County Commission and its representatives. Thank you.
Great. Okay, Dr. Shepke.
Thank you, Governor, for raising awareness on this really important topic. We now have two important medical advances to combat COVID. First is the vaccines, which is a great preventative, still probably our best tool to prevent severe COVID and death. It's something that takes a little while to kick in, maybe 6 weeks for some of the vaccines to really get that protection. But if you're not yet vaccinated, certainly I would encourage you to get that vaccine. However, if you get sick today, either because you're unvaccinated and you're at high risk and you get sick or you get exposed, or even if you're vaccinated and you have one of these breakthrough infections, you have to be high risk, you really need not just the prevention strategy, which is the vaccine, but you need the treatment strategy, which is where these monoclonal antibodies come in. And really, of the monoclonal choices, there's 3 that attack directly the virus, but really Regeneron is the one that really checks off all the boxes for me. It's free for the patient. It's been proven in a couple of randomized controlled trials and thousands of patients to be effective at preventing both death and hospitalization, and as the governor mentioned, post-exposure prophylaxis. It can help prevent you from getting the disease if you're infected. And it works both intravenously and subcutaneously, which is really important from an operational standpoint. So thank you again, Governor. Appreciate it.
And prior to us doing these sites, the way it would work is this was readily available. Again, the federal government had already bought it. Anyone that needed it, the hospitals would do it, whatever. But it was, you needed to go to a doctor, then the doctor would refer you to one of these infusion centers. What we've done in conjunction with these sites is the Surgeon General issued a standing order to say, if you're qualified under the EUA, you can come and get treatment. So you don't need to go to a physician prior to coming here. So it kind of cuts out a step. It allows people to, once they identify the symptoms and their status, then they come and they can do it. So that's, I think, makes it a lot easier, and I think it's something that's going to be important. And then, yes, I mentioned Regeneron was the only one that is approved for prophylaxis. It has the best record against Delta. It also is the only one of the monoclonals that you can do subcutaneously or intravenously. And so the shots, we can run a lot of people through there. The IV, you're hooked up for an hour, and so that just takes a little bit of bed space and time. So I think most of the sites are offering both, but to me, I mean, I think the shots are much quicker. And then what they do is you have to be observed for an hour, but they'll run you through the shots, and then you're kind of observed, just like when we did the vaccines. When people would sit in their car, they would sit in a place where they could be observed. And so we're going to be doing that same type of deal here. So this is 7-day-a-week thing, because our view is the timing is important. If somebody is infected and if they can get in early, that's good. And if for whatever reason they only had 1 day a week where these things are open, then you could potentially miss the window of effectiveness. And so we really appreciate having it open 7 days a week, and we urge people to be able to take it. And I do think it will help drive down hospital admissions. Delta, it's very quick moving. It's certainly more contagious. It's airborne. A lot of these infections, fortunately, are mild. But you do have people being admitted in the hospital, and a lot of people who we never didn't necessarily fit the normal profile even. So I believe if we can turn this in from a disease, and I think the vaccines have helped do this, and then this, to really turn it into something that has basically a flu-level risk. And I think if there's widespread use of both vaccines and monoclonals, that's basically what you end up doing. And so there's a lot of people who've been admitted over the last month who I think probably wouldn't have been admitted had they gotten the early treatment. And so now we'll be able to make sure that there's much more visibility about this and even easier access for people. So thank you. Take a couple questions.
Governor, you mentioned the monoclonal antibody treatment was approved under emergency authorization. Why should people who are hesitant to get the vaccine trust this?
Well, I think they're two totally different things. First of all, some of the reasons people haven't gotten the vaccine, one of the major reasons is that because they've already recovered from COVID. And so they do have infection-conferred immunity, and it's been proven to be strong. Israel's done some great studies on this, and so I understand that there's other people that just make whatever decisions. But here's the thing. If you find yourself infected, the question is what do you do? And if you don't do the monoclonal early, the fact of the matter is there's not a lot of great stuff out there for you. In terms of the treatment of this thing, other than the Regeneron, there really hasn't been a lot. Obviously, it hasn't been stressed very much. It's one of the reasons why people don't know about it. So if you are in a situation, particularly if you're in a high-risk category, this is really hey, come here. Okay. This is really this is your best shot to nuke this thing. This has been extensively studied. I think for sure, I mean, look, I don't know, let me just say, my experience in talking with people is the side effects have been minimal, and even compared to the vaccine. So I think people should be confident in it. I think, again, if you're infected and you have a chance to potentially become severe, well, why not try to just cut it off at the pass? What this does is most people who are getting infected, their body produces antibodies, it fights it off. Obviously, the vaccines help that and you recover. Well, some people, when they get infected, the body's just not producing the antibodies necessarily to counteract this, and so that's what this is providing. It's a cocktail of antibodies that then go to work to protect your body against this virus, and so it's got a good track record. And again, we've seen people get admitted to the hospitals, not just in Florida. I mean, the hospital census, I think nationwide, I think is twice what it was at this time last year. And so part of that is because Delta moves very quickly. But part of it, I think, is because these early treatments haven't been publicized nearly as much as some of the other things.
I understand the strategy for these hospitalizations. I'm familiar with the multi-state contract licenses and DOH expediting licenses. But given the situation with the hospitals right now, would you consider suspending state law to allow nurses with an out-of-state license to come into Florida and to immediately be able to help?
Well, I think that I think that they should be able to do that. I mean, I'd have to look to see. We've obviously supported that in the past, so would have to look. I've talked to a lot of the hospitals. The staff is the issue. It's not space or beds. It's just staff. There's a staff crunch nationwide on folks working there. We obviously had a bunch of folks under contract last year because we didn't know what was going to happen. But most of them are telling me, look, we're stretching. It's our responsibility, and we're going to do it. So I haven't had anyone ask me, hey, send us some more staff. But in terms of if there's any bureaucracy things that we can do, we're happy to look at that.
Governor, Hillsborough County voted last night to keep that mask mandate in place. Where's your response to that?
Well, what they voted to, they didn't vote to just keep, what they voted to do, they had allowed the parents to make the decision and have an ability to opt out. And that's how school started. They reneged on that and basically took the decision out of the parents' hands. So there's parents who were sending their kids to school in ways that they thought was the most healthy for their kids, particularly these little kids, kindergartners, first graders, and they basically took that away from the parents. And so my view is that the parents understand what's best for their kids. Some of these kids, particularly young kids, first of all, they don't even wear the mask properly. I mean, let's just be honest here. A kindergartner is not going to wear it even properly. And so you end up in a situation where the facial expressions, their ability to breathe, all these things are affected. And to what end, I'm not sure, because there's not a lot of data supporting forcing kindergartners to be masked. And I think given that and given how significant this is to a lot of families, I think the parents should be able to make decisions. They've also said, I just saw, that they're forcing the athletes to wear masks during competition. That is not based on any type of science. That is totally overboard. And first of all, to restrict athletes' breathing in heavy competition, where are you getting that? The World Health Organization has always said, do not wear masks while you're engaged in physical activity or athletic competition. And so some of this stuff is just, I think it's more political. I think it's a way to kind of get on CNN and some of this stuff for some of these local union-controlled politicians. But that is not something that I think is justified. And I think it puts the health of these athletes at risk to force them to cover their breathing in the midst of an athletic competition. So I was surprised to see that, but that's definitely something that I think goes way overboard of what would potentially be acceptable. And a final thing I'll just say just generally is, you look around the country, you look around the world right now. I mean, we have Americans that are just being hung out to dry in Afghanistan. We've got billions of dollars of military equipment that's basically just being gifted to terrorist groups. Things that the taxpayers paid for, things that our men and women used. You look at the border, people just pouring in. They don't even tell you where they're bringing these people. We figured out they've dumped people in Jacksonville, some of these other places. It's totally out of control. We've never seen anything like what we're seeing now. You look at inflation, the prices are going out of control, particularly gas prices. That's putting a huge hamper on working people, having to pay so much when they're going to get gas. So you have all these problems, and yet the White House and Biden, their number one issue is they're so intent on having the government force kindergartners, first graders, to have to wear masks for 8 hours a day. They want to take that decision away from the parent, and they want to vest that in local government. We obviously think the parents are the ones under our state law with the Parents' Bill of Rights that have that decision. But put that aside, of all the things you could be dealing with, you're choosing to do this and basically just playing footsie with the unions to try to create political issues. It's a lack of leadership. And meanwhile, So meanwhile, while all the world burns and while parts of our country burn, you have this obsession that a little 5-year-old, should not be able to go to school without wearing that mask for 8 hours a day. And just as a parent, I'm offended that the federal government thinks that they know better than we do as parents. And in Florida, we want to make sure that we're standing by our parents. Thanks, everybody. We'll see ya.